Hey, deserving listeners. So last night, Michael Drane from Unpopular Culture and I were texting about various different behind-the-scenes things that we won't reveal on the podcast. But one of the things that he said was he got some questions, I think, from some listeners to his podcast asking him to talk about kink or the psychology of kink, I think. And he asked me over text, he's like, so, you want to talk about this? And so Michael Drane came over today and we're going to talk about this. And in the span of this morning, I did a little mini deep dive on kink and development and the culture about kink and sexual kinks. And I also reflected on my professional life and podcasting life when it comes to kink and BDSM and other related sexual identities and behaviors. One of the very first episodes we ever did 10 years ago, probably to the month, was with Alina Gabosh, who was, or at least maybe still is, the executive director of the Center for Sex Positive Culture here in Seattle. Seattle is actually known around the world, at least around the country, for being a sex positive city. It's generally more kink friendly, generally more poly friendly, generally more LGBTQIA friendly. And when it comes to sex positive culture and kink, Seattle is also known for it sort of attracts a certain group of people. And Alina Gabosh is a world leader when it comes to sexuality and kink. And we did an episode with her about BDSM and kink, and she brought her submissive with her to the podcast. It's actually a video podcast. You can see it on YouTube. It's one of our more popular YouTube videos. And she asked us to come to her center. It used to be called the Wet Spot. Yeah, but
it's a great name, man.
Yeah, but they changed it to the Center for Sex Positive Culture. It was down in Inner Bay. And they had a number of different activities there. They would have barbecues and meetings and stuff. But one of the things they would do is at night, they turned into like a sex palace along with a dance club.
Oh, a palace. Jeez.
And they'd play like Rammstein and other dance music. And there'd be like people strapped to the rack and they're being beaten and whipped. And there's like vibrating things and like people having sex. I don't. We've talked about this in the podcast before, but so me and Umberto and Lita, who were the co-hosts of the podcast back then, the three of us walk in there, and there's it's over the night. It just kind of. By the way, it was the hottest. So we go in there. And
hottest as in sexiest or temperature wise?
To date, on record, the hottest day in Seattle history.
Oh.
So we're talking like at nighttime, it's probably like 110 degrees.
Bad night for leather.
Right. And bad night for three kind of buttoned up people who aren't really interested in taking their clothes off.
We're just researchers. We're just observing.
Right. At a place where people are basically over the night getting more and more naked. And there was no air conditioning. It was just roasting. But anyway, so we walk in there and there's people doing BDSM stuff. There's this back room where it's sort of dim light. You can have sex or watch people have sex. There were people having sex right in the middle of the dance floor, just like right for an hour and a half. You know what I mean? Like there's this one couple just having sex. And so lots of kinky stuff, BDSM stuff. And after that, I became, because of Alina Gabosh educating me about kink and BDSM, she put me in her Rolodex. She literally had a Rolodex back then. This is 2008 of therapists who were kink friendly and poly friendly. And so I started getting a lot of clients because there aren't that many, at least back then, therapists in Seattle who were identified as kink friendly or kink aware.
It's kind of surprising. I guess it might have been a sign of the times, though.
I think it was a sign of the times. It's definitely increasing. Like at Antioch, Seattle, we just started our sexual, I always forget the name of it, but it's basically in the marriage and family therapy program, we're starting a sexuality concentration that will either give you 6 extra courses on sexuality, concentrated courses and supervision around sexuality of all sorts. And then also another layer to that is becoming a certified sex therapist, an ASECT certified program. And so and there's tremendous interest in it. Like a lot of people are flocking to the program saying, yes, I want that extra concentration, that extra certification. I have some supervisees who currently work at Modern Therapy Seattle. We've had Kate Stewart on the podcast before. She's a sexuality and dating expert, marriage and family therapist from Antioch. She started a group practice and hired some of my supervisees, and they focus on couples with sexuality, kink, polyamorous, other kinds of things like that. And so definitely things are better now than they were before. But I would still say that if you just took a poll of all therapists and clinicians in the United
nationally,
but even in Seattle, honestly, I would assume that the vast majority would be stigmatizing or pathologizing of kink, or just unaware of it. Kind of giggly about it. You go up to an average therapist and you just start talking about like golden showers or something, and you're going to get some giggles. Yeah.
Which of course is just a reflection of their own uncomfortability with the subject.
Yeah, and a cultural thing, it's just like we make fun of kinky, people who do this or that. It's like, oh, it's this funny thing, and there's nothing wrong with it being a little humorous, or there's nothing wrong also with being uncomfortable, but there is something wrong, I think, with therapists who have completely no idea how to help people with these kinds of things because they're closeted and stigmatized and often hurting because of societal stigma and that kind of thing. And couples that have, and I'll get into that later because I've actually treated kink couples before. But anyway, so, that's why we're going to talk about kink stuff today. So this is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I'm a therapist and a professor. Who are you, Mike?
I am Michael Drane, host of the Unpopular Culture podcast.
Great to have you back on. By the way, we're both sick. I'm at the peak of my sickness.
Yeah, I'm also coming out of mine, but you're going to hear some sniffles and some throat clearing for sure.
Yeah, for me too. And if I suddenly start to go into a coughing fit, or if you hear me blowing my nose, producing what seems to be like at least a pint of snot coming out of my face, don't be alarmed by that.
That's just his kink. That's just what he's into.
You never...
Buckets and buckets of snot.
So, all right. So what movies, let's just start out with some movies. What movies can you think of with kink stuff in it?
Oh my God. Well, I mean, widely defining kink. I hadn't even thought about it. How about Boogie Nights? That comes to mind. It's not necessarily directly kinky though. It's more like porn industry kind of filming.
Well, I don't remember any kink. Well, first let's define what kink is.
Yeah,
how would we define kink?
So like clinically what we're talking about is paraphilic disorders in the DSM-5, or more specifically, we might be talking about a fetish. Paraphilias are just like most things in mental health. It's only bound by the human imagination. There's an unlimited number of paraphilias, but there's 100 that have been, at least 100 that have been diagnosed and classified. So it's just like delusions. It's anything the mind is capable of coming up with. So when we define kink or paraphilias of some kind, it's really just anything that is deviant from the norm. And I don't mean deviant in a moral judgment kind of way, but in like a statistically deviant from the mean kind of way.
Right.
It's anything outside of the wheelhouse of what's considered quote unquote normal.
Okay. Yeah. I agree with all that. The term kink is not a technical term. It's, a colloquial term that non-clinicians can use however they want to use. But generally, but actually there is research looking into quote unquote kink. And it's broader than paraphilias in a sense. But anyway, I'll get it more in that in a second. But essentially it's used in a variety of ways. But the way that I would the Gestalt definition that I would apply, there's a lot of different technical definitions, but my paraphrasing basically is what you're saying, Drane, which is unconventional sexual behaviors, whatever that means.
Right.
So if we might think of conventional sexual behaviors, we would think of missionary style, heterosexual, vanilla sex.
Yeah.
We wouldn't call that kinky, right?
Pushing the beds together on Thursday night.
Yeah. Or even like fellatio or cunnilingus or kissing or hugging or playing with nipples or maybe even anal sex, in today's world.
Sure.
is perhaps now, but there we get into culture. It's like,
right.
Is that unconventional to some? For sure. Is that conventional to others? For sure. So there's no line in the sand where it's like, this is conventional and this is kink. It's just in the eye of the beholder. And honestly, in my opinion, what I'll say is that the distinction about kink is actually kind of meaningless to me because, spanking, for example, is one of the most common quote unquote kinky behaviors. And yet probably, I can't remember the stats, something like, more than half of people are into spanking at some point in their life. And so at what point are we just culturally labeling something as kinky just because we culturally don't talk about it very often?
Yeah, anything taboo is going to get labeled. Anything taboo is going to be stigmatized.
Right. But for kinky people, most of them don't really have a problem with saying, yeah, I'm into spanking, I'm into kink.
Sure.
Because the other thing is like, as we start to come out of the closet and progress sexually and liberate kinky people, we can look to these kinds of words, kink and spanking and stuff, and stand up and be proud. We don't have to worry about being stigmatized if we get rid of the stigma. But anyway, so some examples from the literature when they actually study actual humans and ask them what they're into are the following. These are the common ones: spanking, bondage, hot wax, hair pulling, biting, slapping, using food on your body, obedience, play, choking, knife play, exhibitionism, voyeurism, golden showers, master-slave role play, occupational role play like a boss and a secretary, and then fetishes like feet and shoes and silk and costumes.
Have you ever looked at the psychology of just a foot fetish, like what the neurology behind that? It's fascinating stuff.
Yeah. So we don't know. There's no humans are weird to begin with. Sexuality is particularly odd to study. When you think about heterosexual intercourse, missionary style, it makes sense. It's like, okay, procreation, we evolved to procreate as any other organism. It would make sense we would have a drive to put a penis into a vagina, right?
Right.
It just look at ducks, look at chimps, look at fish, there's a drive, and
sure.
And so it makes sense. But when you actually look at human behavior, it's just like there's so many other behaviors.
Yeah, there's so much more going on than just a penis and a vagina. This is not just procreation. Maybe that's why is all this tertiary color and all these different variants that are going around that they deviate farther and farther away from the actual point of sex.
Right. From the biological
a biological perspective. Yeah.
Right. Well, from the procreation.
Sure.
Because biologically, you could say that we get a lot of things like attachment goodies from being close to even someone with a one night stand. You're physically close to someone. You're doing something with them that feels consensual and bonding with that person. And also the dopamine release from orgasm or from touch or excitement,
sure.
In general.
A big problem is when these kinks or fetishes, as in more clinical language, would be when you can't see. That's something I'm really careful to differentiate in when I'm teaching this stuff, because you don't want to, because there's a whole chapter in the DSM about this being a disorder. Mm-hmm. It'd be very easy to be like, well, I have an exhibitionist disorder. And there's a lot of judgment and stigma that can come with that.
Yeah, it's complete fucking bullshit. Right. Excuse my language. The DSM is ridiculous when it comes to this sort of thing. It's in the Stone Ages, and I find that most people, it's just like as clinicians, we just don't even look at that chapter because I don't know anyone who uses those labels.
I've never officially diagnosed anybody like that.
Yeah, no. It's 2018. This was published in 2013. Like, grow up, you idiots! Like,
transvestic disorder.
Yeah,
I mean, seriously,
transvestic. So you have a thing about dressing up in culturally non-binary or unconventional ways or something,
right?
In terms of gender, and that can be considered a disorder in the DSM.
Yeah.
So here's I've done a whole episode on paraphilias, but it's actually taken me till today in my mini kind of thinking about it this morning before recording. What my general thesis is on the DSM, and it is thus. So paraphilias para meaning like next to or non-standard, philias meaning attraction or drive towards something. They're defined in the DSM as the following: any intense or persistent sexual interest other than sexual interest in genital stimulation or preparatory fondling with phenotypically normal, physically mature, consenting human partners.
That is the hottest definition of sex I've ever heard.
Yeah.
Just so you know.
Yeah.
My fetish is hearing you read that definition.
That could be a thing. In fact, if someone was into that, they probably are listening to this episode. They probably
over and over just that part.
Just kind of clicked it, yeah. Which there's nothing wrong with,
No, and that's okay.
Yeah. So part of this definition is fine because they're talking about consenting human partners. They're saying, look, it has to be human. You can't be having sex with animals, and it has to be consenting and physically mature. But phenotypically normal, like what does that have to do with sex? The other thing is
like we have the same eye color.
Well, that I don't even get into that one, but anything other than sexual. So what they're saying is that it's non-pathological if you have sexual interest in genital stimulation or preparatory fondling. That's what they call it.
Preparatory fondle. Hold on. I need to preparatorily fondle myself. I'll be ready. I'll be with you in a minute.
Yeah. So basically they're talking, what they're talking about is, vanilla, even homosexual sex, right? Where it's, your genital stimulation to get erect or get wet or whatever, and then you have sex of some kind. And the thing here is that, so they're saying that that's the definition of paraphilia. So if you're fascinated with a foot, for example, that has nothing to do with genital preparatory fondling, you can't have intercourse with a foot,
Well, but there is, so this is where there is room to justify a diagnosis in this paraphilic wheelhouse if it's like, I can only engage in my fetish and only then can I achieve orgasm or be with my partner in some way, and it's causing marital issues. That's when it becomes something that's when it crosses the threshold of, everybody has their own walk of life and that's cool, to something that could be a disorder that could actually be worked on.
Right. So and to kind of tease that out a little bit, you have paraphilias, which we've described, and then you have paraphilic disorders, which are so you have to have a paraphilia that causes distress.
Right.
And so you're describing a situation where you have a couple, and let's say it's the guy who he can only orgasm or have sexual. The only thing he can do is get sexual pleasure by having his wife's feet in his face while he masturbates or something.
Right. And somehow this is disrupting it for her or something. There's some mismatch because of that kink.
Right.
And so it's causing problems.
Right. So she's either mildly into it or not into it, or she wants to have intercourse and he actually is not interested in that or something, or can't be erect during intercourse or something. Okay. So they come into a psychiatrist office and they say, this is my problem, and the psychiatrist is like, well, does it cause you distress? And the couple is like, yeah, I mean, this is causing harm to our marriage. I want to have regular sex, and I'm thinking about leaving him if this doesn't get fixed. He's like, yeah, I don't know what's wrong with me. I've always been this way, and I don't know what to do. And I try to do other things, and I can't do anything. Okay, so this is causing distress. In my opinion, this is not a disorder.
Right.
This is a sexual proclivity. You could even call it a sexual orientation or something. Who cares?
Well, and there's arguments about something like pedophilia, for example, being a sexual orientation, which kind of convolutes the whole issue.
Right. So, which is one of the DSM listed paraphilias. They have exhibitionism, which again, so here's my thesis is that it all comes down to harm,
Sure,
in a sense that is not tied to societal weirdness.
right.
So,
Functional impairment would be the definition in the DSM.
well, but the DSM doesn't really describe it very well, because the scenario we just laid out,
Yeah.
according to the DSM, is absolutely a qualification for a paraphilic disorder.
Right.
But if they came to me, I would say, I would start exploring it, and I would say, well, there's nothing wrong with being only attracted to feet.
No.
There's nothing wrong with that.
No, in fact, there's some neuroscience by a guy named Ramachandran that's found a correlation between the erogenous, genital parts in your brain. They found the part that recognizes feet adjacent to the part that recognizes genitals, is what I'm trying to say.
Oh, really?
Yeah.
Oh.
So there's actually, and then I have something else here. Yeah, and he found this. Ramachandran's the guy that found phantom limb syndrome. He's the guy that sort of figured out how that worked by hooking up to neuroimaging to the brain and like noticing that an amputee with a missing foot, they're still having pain in that phantom foot that's gone. Well, in some cases, Ramachandran noticed that the patient would have orgasms in their phantom foot, correlating sexual orgasm to just a foot. And so there seems to be a strong link for some people between those two objects.
Wait, so they would lose their leg.
Yeah.
They would have a phantom sensation of a foot.
Yeah, most of the time it's a sense of cramping or pain, right?
Okay.
And so Ramachandran did this really simple experiment where, like, let's say I'm missing my left arm. So I would stick it through a mirror so I could see my left arm mimicking as my right arm. So it looks in the mirror as if I have two arms. And what happens is the patient will report having a sense of relief once they're able to move that mirrored image. It's as if it's the same sensation of when your leg's cramping and you need to kind of stand up and shake it off a little bit.
Yeah.
So within that connection, the same mechanisms that tell somebody with a phantom limb that you still have a limb, your brain won't let go of the idea that there's no foot there, there's no arm there anymore. That same connection can sometimes produce orgasm within that phantom limb.
That doesn't make any sense to me. I mean, so you can't, what do you mean orgasm? Like, what do they describe?
They describe sexual pleasure.
But orgasm?
Yes, like as if the phantom limb were genitals. It's as if the same sexual pleasure one might get from touching their genitals, they're getting that same sensation from the phantom limb.
Weird.
It's insane. It makes no sense, but it shows a strong neurological connection there. I mean, it's not that weird when you think about, because we know that people in their phantom limb experience pain, they experience cramps. They'll say that they can still move their fingers even though their hand is gone. They have all kinds of ghost after impressions of various kinds. So really, we're just throwing sexual pleasure into that with pain and cramping and a sensation that the thing is still there.
Yeah.
But it's from that he noticed that there's a correlation between the foot and genitals for some people.
Interesting.
Yeah.
Yeah. Interesting. Well, so getting back to DSM, to me, it's like, so they include 8 different things. You have exhibitionism, fetishism, frauderism, pedophilia, sexual masochism, sexual sadism, transvestism, and voyeurism. So the whole thing here is it harming people in a way that is not societally stigma related? So if someone has just take the first one, exhibitionism, they totally get off by masturbating and making other people watch them, for example.
Right.
Louis C.K. seemed to have kind of an issue with that. Now, if you manage to get consensual people to do that with you, and let's say it's the only way you can get off, well, and it's causing you distress because in your marriage, your spouse actually wants to have physical contact with you, but the only way you can get off is to have people watch you. And you never walk up to a stranger, you never harm, it's never non-consensual. Well, according to the DSM, you have a disorder with exhibitionism, paraphilia disorder.
Right.
That's ridiculous.
Yes.
So now, if you are walking onto the subway and masturbating in front of a bunch of people and it's non-consensual, then absolutely, I'm fine with calling that a paraphilic disorder.
Yeah, that might constitute functional impairment, I think.
It's causing harm to other people.
Right.
I'm willing to call that a disorder.
Sure.
We can get into the philosophy of why we label some things disorders. Like, we don't have anything in the DSM called murder disorder. Like, that's a functional impairment. Someone walks up to someone and kills someone.
Yeah. We
don't have any name for that. We're just like, well, I don't know. It's just a behavior that people do that's bad. I guess it might be associated with a personality disorder, but who knows?
Yeah, it's more of a symptom of antisocial or something. But it's
but
not its own thing.
Could be,
Yeah.
but most people who murder people don't have antisocial.
Sure.
So it's like, we're fine with some things not being in the DSM. So to me, it's like, why is this included in the DSM at all?
It's because it's sexuality. Homosexuality was a mental disorder in the DSM-3.
Right. To me, this is like the last vestige of that.
Yeah.
And there's not a lot of people willing to stand up for these people because they're even more stigmatized than homosexual people.
Yeah.
Okay, so you go to fetishism. Again, we just gave an example of the foot thing. Frauderism. Okay, if you're walking onto the bus and you're rubbing up against people who don't want to be rubbed up against, then yeah, I'm willing to call that a paraphilic disorder. If you are doing it, consensually, or you're really into the fantasy of frauderism or something, that's frauderism, right? You rub up next to people.
Frauderism, yeah, touching or rubbing against non-consenting person, but the non-consenting piece is in the definition of a disorder. So,
right.
So just that, but we're making room for the idea that it doesn't always end up in this way. You might have some way to make that consensual and fine.
Right. Like, there are people, we have talked about this in other podcasts, who have a significant rape fantasy.
Yeah.
Men, women, non-binary people have a fantasy to actually rape other people non-consensually. Most of those people do not ever do it, but would we call those people pathological because they have a rather common enough fetish in their mind or fantasy? I'm not going to call them like they have a disorder. And then again, you go to transvestism, like we talked about earlier.
That one is just ridiculous.
It's like, if you take a man, for example, who can only have sexual pleasure or gets tremendous sexual pleasure or is intensely attracted to dressing up as a woman, quote unquote, whatever that means in your culture. And it causes him a lot of distress because society judges that sort of thing. And his family judges that sort of thing.
Yeah.
And he's closeted, he's stressed about it. You go to a psychiatrist, well, he qualifies for transvestism paraphilic disorder.
And with that, maybe some medications to go along with it.
Yeah.
And which really another clinician might look at as just gender identity.
Well, but it could be gender identity, but it also just could be a fetish.
Sure.
So you could identify with the genitalia you were born with.
Yeah.
And the gender identity of what society would give you upon being born, I should say, and also be super into dressing in the quote unquote other gender. And I say quote unquote other gender because different societies have different ideas about what that exactly means. And so yeah, it's just so to me, what the whole chapter in paraphilias or section on paraphilias could be summarized as in one thing to me, which is any sexual behavior that causes harm to yourself or other people that is not societally related.
Right.
And that should include things like vanilla sex.
Yeah.
If having intercourse somehow produces tremendous distress to other people or yourself that's not related to stigma or society, then I'm willing to call that a disorder. Why do we have to single out these 8 very particular things?
Right.
It's really very silly to me.
Well, we got to acknowledge it goes beyond the 8. Paraphilias are just basically anything. I could be attracted to shower curtains. I could be attracted to anything. And it helps me to, just like anything, it helps me to look at this as a continuum, as a spectrum. And what convolutes it more is within this paraphilia wheelhouse exists, like we said earlier, is pedophilia and things that are obviously, I just say pedophilia and your mind already goes to a certain place. There's really no way to make that consensual. And yet people continue to have these impulses and these urges. So it's not the underlying urge that you have, and whatever urge you do have might have to manifest to one degree of intensity or another, but it's about how do you make that fit within society. But also what you're saying, Kirk, is just in general, aside from the really heinous piece of this, you do you. People should feel free to do what they need to do. Right. There's nothing wrong with expressing sexuality, and not everybody needs to have vanilla sex. This runs a lot of risk of just stigmatizing.
Right. Yeah, and our profession, supposed to be better than this.
Yeah.
It's fine when BuzzFeed or, Twitter or Donald Trump decides to say something along these lines. It's like, okay, I get it. You're stuck in the dark ages. Society, we're Victorian, we have extreme Victorian roots. It makes sense. I'm fine with that. But we are supposed to be the cutting edge of understanding and of accepting and really researching these kinds of things.
Right.
We're supposed to be science-based, and this is, in my opinion, not science-based. Now, having said all that, there are absolutely people who suffer from these disorders. Someone can have exhibitionism, paraphilic disorder, who, is basically has this compulsion to expose him or herself to, random people on the street and is sexually assaulting other people in this way. And they go to treatment and they get labeled with this label, and I'm fine with that. But the DSM does not describe the exclusions and caveats well enough. No. In fact, I don't even think they get it. I think if the authors of this chapter were sitting here, they would actually argue with us. They'd probably say, like, no, you don't get it, blah, blah, blah. Like, that's a problem. Like, I would guess this is all just speculation, of course, but I would guess what they would say is, if someone can only have sexual pleasure by masturbating into a shoe, don't you think there's something wrong with that?
Yeah, and that's the judgment piece right there.
Right. And to me, it's
but masked as criteria, because how they're dressing it up, their point is they can only achieve orgasm by doing this one thing. Isn't that a problem for them? And
right.
And the answer is maybe not.
Right. So, because to me, it's like, by what definition? It's like, okay, what is the defining difference between vanilla intercourse and masturbating into a high heel shoe? And they'll be like, well, masturbating into a high heel shoe has nothing to do with procreation, they might say.
Right.
And I'd be like, well, homosexual sex has nothing to do with procreation. Yep. So where's your evidence there? They're like, oh, well, but they don't have any flexibility. Yeah. Well, it's like, well, what if you can only have sex with intercourse?
Yeah.
In a very particular way. Would you call that a disorder? They would be like, no. And I'd just be like, you're an idiot, because you're a fucking idiot. And
go home.
Pull your head out of your ass, people. Okay.
That's my fetish, pulling my head out of my ass. That's great. Well, can we dive into one of these? The question that was asked by the listener, she asked specifically about something called
First, actually, let's take a break. Well, let's ask the question.
Okay.
And let's take a break.
We'll set it up. Okay. So when we come back, we're going to talk about paraphilic infantilism, the paraphilia to dress and act like a baby.
Oh, okay. All right, we're back from the break. If you haven't become a patron of either of our podcasts, do so now. Go to patreon.com, become a patron of Psychology in Seattle and Unpopular Culture. When you become a patron of the podcast, you know that you are actually giving us the literal fuel to be able to do this kind of thing.
Literally.
I guess it's not literal fuel, but
metaphorical
literal
fuel.
Ability.
Literal ability. There you go.
To do this sort of thing. We have busy lives, and when we actually get money to do this, we can, scale back on our other activities to actually do this. And that's true for me and Michael Drane.
Absolutely.
So this person wants to, why do they want to know
Let me
this?
just read what she wrote here, and then we'll kind of set it up. She goes, she's interested in the psychology of kink and why some of us are attracted to it, especially things like age regression, which I want to ask you about with your psychoanalytic background, and sex clubs. Anything to do with this subject, she just wants to hear us kind of talk about it. So I took the spin of the paraphilia of acting like an infant or dressing like an infant. And when we're we're talking about masturbating into a shoe, and we're talking about like cross-dressing and certain things that it's more understandable to see how that could kind of work. Some of these cases, and it's weird because some of these infantile paraphilias, until 1980, there were only 2 cases recorded. So it's really up and coming as far as our understanding of it. But somebody, like there's a case here who, a 20-year-old college student who has to defecate in a diaper to achieve orgasm. Didn't think he was a baby, so there's no delusional quality to it. But there's cases of people who have to dress in diapers and act very regressed in age. And so that is a presentation where it's like, okay, I can see how your partner would have trouble meeting you in that place.
Right. And it's a matter of compatibility.
Sure.
Understanding, because so I've treated a lot of couples with things like this.
Yeah.
Well, not a lot, but some. And the typical scenario, if someone came into me and they were complaining about that, you have a man who that's the only way he can do it, and the wife's like, I have no interest in seeing his poo or anything like that. So right. What do we do? Well, then you talk about how in love are you? How compatible is your relationship in general? How do you see your sexual life being? What kind of sexual goals do you have? Because for some couples, they're just like, we don't have sex very much anymore, and that's kind of a bummer. But take the good with the bad. We love each other. We're bonded, and we're fine. So there's no clear cut decision around this. The other thing is to explore with the person who has the fetish of just like, well, how might we be able to sublimate some of this? Like, do you have to actually poo during this? Is there some way you could do this? Could we incrementally start to expand that sexual act to other kinds of things, which I've worked on with people, and it can work. I try not to stigmatize it and say like, you need to expand this, but I just throw it out there. It's just like, so if you would like to expand this, then let's do this. Now, politically, though, again, it becomes problematic because let's say you had a gay male come in, he's married to a woman, and he's like, I'm only attracted to men. What am I supposed to be doing? I would never say to him after exploration, you need to expand, let's talk about expanding your sexual repertoire to having sex with women, right? It's not fair even to get on. That's basically conversion therapy.
Yeah, I was just thinking that. So you have to walk this fine line of acknowledging the fetish and respecting that they have a feeling in that way, especially in cases where if it's like a homosexual feeling or the transvestic disorder comes to mind. So it's that, honoring that versus the problem that it's causing in their life.
Right. And what I do, I just self-disclose. I just say like, so politically speaking, I feel weird about asking you to quote unquote expand your sexual repertoire because I personally think that you're entitled to have whatever kind of narrow repertoire you want to have.
Sure.
So I don't know what to do with that, and and just throw it out to them. And then if they're like, well, I get that, but I want to save a marriage, and I think it might be able to work, and so let's try. And so you just incrementally try to. You start with what works for them, and you just start to expand that out by trial and error and by associating orgasm and pleasure and safety with other kinds of behavior. And this can go for any kind of thing. Someone comes in with erectile dysfunction or some kind of arousal problem, and it's the same thing. It's a matter of it's trial and error, safety, communication. Looking into your trauma history regarding sexual abuse and anxiety and all that kind of stuff. And so it's a very all-encompassing kind of holistic approach, that needs to be needs to be taken.
And it really comes down to finding middle ground with the person and their partner and seeing if there's any way to come to the table in a way that everybody can compromise, really.
You said come to the table.
I did say that.
So the question I think that the person is asking, or at least that you're asking, is what's the development?
Developmentally, yeah.
Right.
I'd love to explore, especially kinks that involve age regression, as she put it. So infantile paraphilia, or even other versions that I can't readily think of. But
yeah.
So you take like a foot fetish or something that doesn't seem to have an origin, and we found a possible neurological explanation for that. And there's things like objectophilia. Have you heard of objectophilia with people? Like I did a show on this. There's a list of people like there's a lady that married the Eiffel Tower. There's a guy who's had sex with over like 120 cars and only had one sexual human partner. People. So there's a philia strictly for objects, and they talk about it as if they talk about it like it's their sexual orientation. Just the language that they talk, it kind of reminds me. It's like, I've always felt this way. I grew up this way. I don't know where it happened. I just saw the Eiffel Tower and I knew I was in love. And I can only achieve orgasm when I'm thinking about the Eiffel Tower. Or there's one that's married. There's one that's married to a roller coaster ride back east. And it's not delusional. They don't actually think that the roller coaster is a person or something like that. But they have this innate impulse, this sexual attraction to it. And so when it's something like that, like I see like fetishes. So like a fetish is an attraction to an inanimate object or a body part. So those kinds of things, I can kind of go into the Ramachandran neurological explanation, but something with age regression, like acting like a baby or being, that's more of like a sadomasochism, relational, dominant, submissive sort of quality that feels more developmental to me. Do you know what I mean? Feels like it's more buried in their past. So yeah, I don't know. I haven't worked with anybody like that personally, but I think it's at least possible that there's some kind of developmental piece in their past that manifests.
Yeah. So here's my model. And it's in line with basically what you're saying. And there is no difference between neurological and developmental. They're the same because you develop. When you develop, your brain is developing,
sure,
and you're making connections. And so here's the model that and I'm not an expert, but this is the one that I've been developing after talking with different experts in different fields. Is that we're born. We're different than other animals in a number of ways. One is that we have an extremely long period of childhood, right? Other animals, you have like horses that within seconds of being born are walking around.
Yeah.
You know what I mean?
Yeah.
Or you have fish who are feeding and eating and on their own without any guidance or anything. So humans have a really long childhood for a number of different reasons, but our brain is developing over a very long period of time. And I think one of the things that I think people think of as to why that is, and I'm going to use really stupid, unexpert language around this, is that it gives us a chance to learn from what's our environment and our social environment and our physical environment. We're adaptable in that way. And so sexuality is the same. So in the way that we learn language, we adapt to the language context that we're born into. We learn how to hunt or how to, sow the fields or whatever from our, we're not born with the ability to hunt. We're not born with the ability to grow food. We learn that from, as children. We learn language and that sort of thing. Well, sexuality is a similar thing. And so, and it takes there's a number of years when we're pre-sexual, essentially. We're sexual, but we're reproductive. If that, again, this is non-expert language. But anyway, this is to get to the point that as our brain is developing, we evolved essentially to be imprinted upon in terms of what sexuality is to our context. So in the old days, and I've talked about this before on the podcast, what that meant was, in all likelihood, you were in a small tribe of 30 to 40 people, and you would occasionally, as a child, 5, 6, 7-year-old, you would occasionally catch glimpse, or at least you would be aware of people having sex, whatever it was that the tribe was doing. And that would imprint upon you what sexuality is. And not through learning, but it would actually be a neurological experience. So, for people who have fetishes and who have kinks, they'll describe, because they've done research on this, is what they'll describe is from an early age, they can sort of trace back an interest. So if someone's really into shoes, for example, they can remember being 5, 6 years old and being really interested in shoes. They're not masturbating yet, because they're probably not anyway, because it's not, it hasn't risen.
It hasn't matured yet to that.
Yeah. But they remember early on, and then they, when they're 10 years old, they feel different when they walk into a shoe store or something.
Right.
There's just something kind of different about it. And then when they're 14, they actually are masturbating while they're thinking about shoes or something like that. So this is a long point to get to what I'm going to say. My model is that humans are born with a disposition for, most of us are born with a drive to have sex.
Yeah.
Some kind of drive to have sex of whatever kind, just some sort of sexual drive. And then as we're developing in early childhood, later childhood, there are certain things that are likely to be associated with sex that either because they are overtly associated with sex in the environment, or they just are neurologically kind of closer to sexuality or something along those lines. Like someone could, someone's playing the game, they're 5 years old, 4 years old, and they're like, I'll show you mine if you show me yours.
Sure.
Kids will play this game.
Yeah.
And then, it's a girl and she walks up to a boy. She's like, I'll show you. And they're like, okay. So they show each other their genitals. And then in that moment, she sees his elastic band on his underwear or something.
Right.
And so as she is observing, it's a very impressionable moment for her, this young 4-year-old girl. She sees a penis. She sees elastic band. It's sort of sneaky. She's being assertive. It involves her genitals.
Right.
She feels kind of free. There's some sensuality to it. Some 4-year-old version of it. All those things get associated in that child's brain, and then maybe age 7, she is in PE and she sees a little elastic band on one of the boys, and she gets a little jolt of sexual energy, kind of this remnant, this association that she built when she was younger. Now, of course, evolutionary, this makes no sense because elastic bands didn't exist until, like 100 years ago or something. Yeah. So it's just this evolutionary mechanism that we likely developed to make us susceptible to what is in the environment, because we might not know exactly what sexuality means in a particular context.
I agree. Maybe the fetishes themselves are adaptive in that our brain is seeking to define ourselves, our sexual identity, and so we're attaching ourselves to things like elastic bands or objects or situations as a way to try to make a definition for ourselves, something to grab a foothold onto in the world to be sexual. Because that could, like your scenario with the 4-year-old and the elastic band, she could have been attracted to elastic bands, but she or he or anybody in that situation might have grown up to be an exhibitionist too, because they showed their penis when they were 4 years old. And now, but there's a relational, developmental, early childhood starter point to this kind of thing.
Right, exactly. And so, for example, with an infantile thing, if someone could only have orgasm, or their narrow sexual pleasure is derived when they are in a diaper and they're being treated like they're 6 months old by someone else, in all likelihood there was some association that happened either when they were an infant or when they were older and maybe saw an infant or something.
Agreed.
And now, what's a lot of people will say is like, oh man, this is really dark. It's like you're involving children and sexual abuse maybe, and absolutely that can happen. But the vast majority of people who have kinks, in my mind, it's not necessarily associated with some kind of abuse growing up.
No.
It certainly can be.
Yeah.
And for those people, they can have complicated relationships with their kinks. But for some people, it can be a way of almost combating the trauma. It's like, I'm going to take this over, like someone who was spanked and raped by their grandfather, over the span of a number of years. And he grows up and has this association with being spanked and orgasming, and he totally knows, well, it's because my grandfather used to spank me and rape me. And he at first is like, well, I don't know what to think about that, but over time he's like, you know what? I'm going to embrace that part of it. I'm pretty sure it comes from the fact I was raped by my grandfather when I was a kid, but you know what? I don't care. I'm cool with it.
Yeah, now it's an adaptive outlet for me to work that out.
Right.
And really, it is making the most of your trauma in a way. I mean, you took something horrible that happened to you as a kid, and you found a way to make it an adaptive, positive outlet for you. What other kind of scenario would you want to come out of that?
Right.
Really kind of the best case scenario.
Yeah. So what movies have? Can you think of any other movies?
Okay. Kinky movies. I have nothing. I'm drawing
there's
a blank.
one massive movie series that are out right now.
My student just presented on it. The 7 Shades of Grey. 50 Shades of Grey.
Yeah.
Yes.
Exactly.
Yeah. Sadomasochism.
Yeah. Also, the movie Secretary. Have you heard of Secretary?
No.
It's a really good movie. It's actually my favorite movie that depicts kink. Maggie Gyllenhaal and James Spader.
Oh, yeah. Okay.
Probably like 15 years ago or 10 years ago. It is actually, after watching that movie, I understood BDSM for the first time in my life. Like I sort of got
Why?
it.
What was it that did it for you?
Well, because the whole movie, it's been a long time since I've seen it, but it's basically James Spader is a lawyer or something, and he has this office, and he hires this new secretary, and he slowly starts. So the whole movie is just the two of them. There's not a lot of other characters. So the whole movie is them developing this relationship and their characters and stuff. And slowly he starts to do little BDSM things to her as his secretary. Not anything like really horrible, but just
testing the waters with her?
Maybe.
Okay.
Or just he can't help it. Like he just has this urge to do this. And she finds herself responding positively to that. And their relationship kind of spirals out of control in terms of like, or in control or whatever you want to say. And the BDSM stuff just gets more and more intense, and they both love it.
Huh.
You just get a sense of what it's like for people who like to be dominant, people who like to be submissive, particularly for people who like to be submissive, because I think it's probably easier to I don't know, relate to someone who wants to dominate other people. But it might be harder, particularly if you're not into being a sub, why you would want to be dominated and sort of bossed around and harmed in some ways by another person. And this movie, Secretary, really explains that well in my book.
Huh. What do you think about Game of Thrones as a template for various kinds of sexual fantasies? Like I'm thinking about the torture scene with Reek being tortured by, is it Ramsay Bolton?
Yep.
I mean...
Well, it was Ramsay Snow at the time, but...
Yeah. So is that not essentially some version of a sadomasochist kind of scene?
Sure. I mean, Ramsay was sadistic.
Oh yeah.
And I don't know if it was sexual for him. I think it was just his sadism coming out.
So sadist, but not no sexual component to it.
It didn't seem like it.
Yeah, no, not necessarily.
Yeah. I mean, there was a sexual scene where he tricks Theon that
he's eating his penis.
Well, where in the TV show, I can't remember if it's in the book. It's been so long since I've read the books, but where he gets a couple women to have sex with Theon, and he tricks Theon into thinking. I can't remember exactly how this scene goes, but yeah, for sure. 9.5 weeks. You're probably too young to remember how popular this movie was in, I think, the late 80s. Mickey Rourke and Kim Basinger.
Basinger's how I say it.
Basinger.
What do I know?
But yeah, super hot Mickey Rourke and super hot Kim Basinger. Just in 9.5 weeks, and there's some mild kink stuff in that anyway. Exit to Eden is probably the most overtly BDSM movie, aside from Secretary and Shades of Grey. It's a comedy in the 90s. Rosie O'Donnell and Dan Aykroyd this is back. It's funny to think that Rosie O'Donnell used to be just a regular actress.
Yeah.
Just a comedian.
Before she was Donald Trump's punching bag.
Right. But from my memory, the movie is that Rosie O'Donnell and Dan Aykroyd are cops, and they have to infiltrate this kink commune and solve some crime. And so they have to become kinky, and they have to do whips and leather and everything. And it's it's supposed to be this funny thing. But
do you think in general, this is almost too generalized to even answer this as a straight question, but do you think the average person could have some room to explore their kinkier side? Like those two in that movie is what got me started. Like normal, quote unquote, normal people exposed to a BDSM world or a fetish kind of world, and find things within themselves that they're starting to identify with if they can keep an open mind. And is that not kind of healthy to explore that?
Absolutely. If people want to,
Sure.
I mean, some people are fine and satisfied with their current repertoire.
Yeah.
But for sure, the question I would pose to you out there listening is this. Really think about what you think about when you masturbate or have sex.
Yeah.
Really think about it. Just, don't just let it go by in the moment. Really just take an inventory of the kinds of things. If you were to write it down, I, Jane Doe, think about the following 5 popular fantasies in my mind, and just really think about if any of those qualify as kinky, because I'm guessing that they probably do.
I love it. And then notice what kind of feelings do you have around that when you start to identify those things?
Right. Whether it's like, I don't know, tattoos or tattooing or bottoms, butt cheeks,
yeah,
or something to do with semen,
yeah,
something to do with female orgasm, female juices, things. This is probably going to get an explicit rating on iTunes. Right?
Mine always do, just as a safety measure.
If it has to do with biting or slight dominance, rough sex, for example, hair pulling.
Yeah.
That I would suspect that most people have. In fact, there was this one study I found this morning that asked women about their kinks.
Yeah.
And what they found was that the following. So, what do you think the 5 most common women kinks were?
I would probably say submissive related fantasies, rape fantasies, maybe.
No. I mean, so number 5 is bondage toys. So
Okay.
I think that sort of hits it. And other ones kind of have something to do with it, but they're more specific.
I might be being too general, but role playing stuff.
Nope.
Okay.
I mean, definitely on the list of like the 40 that were identified.
Yeah. Okay. So more specifically.
Yeah.
Okay.
Michael's now sort of going through his Rolodex of kinky behaviors.
Can I phone a lifeline? I've never been a heterosexual female before. I have no idea.
Well, it's not just heterosexual.
Oh no. Okay.
It's everybody.
Well, either way, I don't know. Tell me.
Well, I'll give you one, and maybe it'll spark
maybe
you out.
jog me. Yeah.
Number 1 is spanking.
Oh, okay. Okay. So like biting,
That's number 3.
hair pulling.
Number 2.
Yes. Yeah. I'm onto it. I'm onto you now.
And number 4 is scratching, which I wouldn't have thought, but
See, this is all one thing in my head.
right, one thing. But they actually broke out all the different. But so they have like golden showers and role playing and feces. Feces stuff was the least common. It was like very uncommon feces stuff. But anyway, so yeah, and so these are these five, if I remember the statistics right, were something like 95% of the women respondents said they either enjoy doing it or they enjoy having it done to them or they enjoy watching it.
Yeah.
So, and they sort of broke it out into those three things. Do you like to have this done to you? Do you like to do it to others? Or do you like to watch it? And these five things were the top five, most likely that they would have at least one of those.
Fascinating.
Yeah. Some like, again, we're talking like basically almost every woman has some kind of interest in those five things.
Interesting.
And these are supposed to be kinky, meaning unconventional.
Sure.
But when you have almost every woman saying they're into it,
it's actually way more conventional than people realize. Yeah.
Right. So it's
that's my theory is that it's not that most people don't have kinks and there's some deviant population that does. I think most people do, and those people are repressing their sexuality to fit social cultural norms and stuff.
Right.
Interesting, because I have something that describes the typical characteristics of what somebody with a paraphilia is. So that includes every single thing we're talking about. That's a very wide margin. But the typical presentation for a person with a paraphilic disorder, what would you think demographically?
Well, if it's a study
all
of
paraphilias.
But do they just do a blanket survey of like everyone in society? Because if you just did find people with those labels, then you're gonna find a very particular sort of person who's been labeled that. But if you just did like a blanket thing across society, then I would say there is no profile.
Okay. Well, according to Reichenberg and Siegelman, the typical presentation for the average paraphilic disorder, which is a wide definition, but a 37-year-old married middle-class white guy with some college education and a job. That's pretty much but they found that people with paraphilic disorders actually come from all ethnic, racial, gender, all that.
Right. And I'm guessing what that study was trying to demonstrate is like, it's not gross, it's not people you associate with grossness,
No. This is out of a psychopathology book that's trying to teach paraphilic disorders to a student learning it and trying to give general client characteristics of what they might see. Like another example is nearly 50% of people with paraphilic disorders, now we're calling them disorders, are married and have marked impairments in their capacity to maintain that relationship. So in some way, the relationship is being damaged, which is probably why it's a disorder.
Right. So, and I've treated people like that. I actually treated someone who fits that profile who had a voyeuristic paraphilic disorder in that he liked and engaged in watching women who didn't know they were being watched.
Right.
And he came to me saying, and he had done some extremely light behaviors, or at least admitted to them, and came to me and said that he didn't want to do that anymore. He was scared of it escalating and getting to a point where he would harm someone and or get imprisoned or something. And that's a typical presentation of someone who we would label as having the disorder.
Right.
But research does show that men are much more likely to have a wider variety or more intense, unconventional sexual fetishes. But I think it just kind of depends on what we define as that, because again, when we look at this study with women, nearly all of them are into spanking, hair pulling, biting, scratching, or bondage toys to some degree, whether it means watching or having it done or doing it to other people. And it's like, I think we're just sort of in a time when our data regarding sexuality is just kind of limited,
and skewed and biased.
Yeah. So, but there is some evidence and some, speculation that makes some sense that men would have more likelihood of developing a paraphilia or an unconventional sexual thing because perhaps men evolved to have sexuality that is more dispersed, shall we say, whereas women maybe less. I don't know. I hate speculation like that. So.
Yeah, it's hard because you're constantly putting things in boxes. So here's another one that's really interesting. Masochistic disorder, right? So the ratio from that for men to women is 50 to 1. So for every 50 guys with masochist disorder or masochism tendencies, there's one woman out there that has the same thing.
Well, that's interesting.
Yeah. Huh. For sadism, it's 20 to 1. 20 men to 1 female. So that's, number wise, when we talk about paraphilia, it is vastly men, appears to be. Not to say it's only men, but interesting.
Yeah, it is interesting.
And of course, they never go out and get help for this usually because they're either closeted about it, they're ashamed of it, they're trying to work at it on their own, and it's only when it starts to affect some relationship that they start to actually try to get help usually.
No, yeah, I would assume 99.9% of people who suffer from some sort of paraphilic disorder that I would apply, not the kind that society would apply, never seek help for it, for sure. For a large reason for this is because people don't think that they'll get any help, or that they think they'll be locked up, or they think they'll be stigmatized or something, and that's probably true.
It's probably true, right?
Right. If you, for example, the client who came to me with a problem with voyeurism, harmful voyeurism, non-consensual harmful. If he went to a different therapist, I don't know what they would have done.
Yeah.
And so that's why you therapists out there have to become two things. One is kink friendly, which is essentially you're not a bigot towards kink people.
Right.
And two is kink aware, meaning that you have education and supervision and experience around helping clients navigate the world of kink. Just because you're friendly to it and you're cool doesn't mean that you're able to really help people navigate that world. It's similar with polyamory. You could be poly-friendly and you could be poly-aware or poly-responsive or poly-competent, shall we say. It's a particular thing. Poly and kink worlds, there's a bit of an overlap, and so I'll kind of lump them together to some extent. With poly people and kink people, it's a particular world, and it's a particular culture, and has a lot of different things to it that have to be understood before entering into a therapeutic relationship with a client. For example, when I am treating clients, like I had a couple who had various different kink things that they would eventually tell me after years of building up to it. And
shows you how closely they guard it right there.
Right. And even then they were pretty sheepish about the whole thing.
Yeah. They might have gone their whole lives not telling anybody ever.
Right. And so now I could say, well, I'm friendly. Okay. I'm not going to judge you. Yeah. But what my knowledge and supervision, actually, I've never received supervision around this, but my knowledge about it and experience with it helped me to actually lean into the issue and actually ask particular questions in a way that helped them to tell me more. And eventually so we discussed a lot of different things. And mainly what I had to do with was communication, knowing what you want, knowing how to communicate that, knowing how to be assertive, knowing how to give in on certain issues and not give in on others, knowing how to assert your own sexual needs. And, there's just a lot there. And this applies really to any couple for sexuality. But as a particular instance, there was this one instance where they were doing some kink play and the husband took it too far.
How so?
Well, I probably shouldn't say specifically, but he took it too far, and the wife didn't like it and felt hurt emotionally and physically. And they came to therapy with that issue, soon after. And if I was just friendly, then I'd just be like, okay, talk about it. But I would have missed the nuances and the language and the premises that are involved in that kind of exploration, like well, had you talked about this before?
Yeah.
You know, who broke what rule? You know,
Right.
because when it comes to poly people and kink people, the joke is that, you know, what's the difference between a swinger and a polyamorous person? Do you know this joke?
No.
Swingers have sex with a lot of people, and polyamorous people talk about having sex with a lot of people. So swingers are, you know, considered, you know, open relationship and blah, blah, blah. And there's nothing wrong with that. But polyamorous people in general, they tend to communicate a lot. You know, they tend to be like, okay, I'm going to go to this party by myself. You're not going to be there. What am I allowed to do?
Yeah.
Well, you're allowed to kiss people, maybe some French kissing, but maybe some light, you know, genital petting downstairs, but nothing more than that. Okay, fine. You come back home. What did you do? Well, I French kissed this one guy. I touched this one girl's boob. You know, there's just a lot of reporting, a lot of talk,
and a lot of trust, and a lot of mechanisms any poly couples I know, they've successfully made it work because of those rules, and the trust, because you got to trust that they came home and they followed those rules based on their own self-report.
Right.
You know what I mean?
Yeah.
You can't just accept it.
Right. Whereas quote unquote swingers might not necessarily be that way. They might, but they might not. So now some poly couples are like, I don't want to hear the gory details, but at least there's there's talk about what the rules are and what the protocol and what the communication is. Well, it's the same as applied to kink. So if you're involved in whipping and knife play and blah, 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 then, you know, there should be some talk prior to doing, or at least, you know, amidst, so that everyone understands what's happening and everyone knows where the limit is and that sort of thing. And that's where they had that hadn't occurred with this particular behavior with this couple. And so it took a number of sessions to kind of work it out, because it scared the wife, you know, and it was very hurtful to her and really betrayed her trust, and it freaked him out too.
Yeah, I was going to say, I wonder if it scared him and how far he went with it. He might have been opening up and not realized, oh my God, look how far I went with this.
Right.
How far could I go?
That, and he thought that he thought the rule had been established.
Oh, I see.
And he was mortified that by the way she received it. You know what I mean? Like it was very distressing to his identity to have his wife, you know, experience him as a abuser, essentially. It was extremely distressing to him, to the point where, you know, it was a very emotional process for him, mainly, actually. She came to the session half worked out the issues. You know, she's like, this is what happened. For him, it was a very difficult struggle of like, wait, what? You received it as what? Like, and that means I did what? Like, no, that's not what happened. And I was like, slow down. Like,
yeah.
You know, and she was like, whoa, you know, it's just like, you know, it's everyone just slow down. Like everything, you know, we're all safe here. It was very distressing. And
seems like there's a piece there too, where he's got some strong aversion to being seen as an abuser. I wonder if there's a part of that that's related to the kink. Like, it's like, I mean, we're talking about this hypothetical scenario where my kink runs like I'm a masochist and I just, or I'm a sadist. I just really want to choke my wife or something in bed or something. But I was abused by, my parents, and they used to choke me and hurt me. And somehow this is manifested later in life as a kink of some kind where I want to choke them. But I went too far with my wife, and now she's really scared. She sees me as an abuser, which relates me back to when I was abused. So it's touching on all this trauma,
right,
that goes right back to the source.
Yeah, I mean, how awful would that be? It's
totally.
Like, I thought we were just playing around with this. Now I am my abuser.
Yes.
I mean, that's pretty, you know, identity shattering.
Absolutely. And all I was trying to do is find an outlet for this that could have been healthy.
Right.
And what does that do to, how do you try that again? Like, okay, well, this is still a kink of mine, but I've sort of damaged my shot here with my wife in doing it. Now we have to try it again. And so that's why these rules and these guidelines are absolutely crucial. You have to know where the bounds are.
Yeah. And to know that mistakes are going to be made sometimes. And that was basically what the wife eventually got to quicker than the husband was, look, yeah, I experienced it this way, and it was awful for me. But, shit's going to happen.
Right.
And I don't want you to do it again, and I want you to think about what you did, but it's not the end of the fucking world, husband.
Yeah.
She was just like, calm down. Like, it was awful,
Yeah.
and I don't want you to do it again, but you're overreacting.
Right. Which says something.
Right.
I think.
Which, I understood both people's reactions,
Yeah.
honestly. I understood his big reaction.
That's why you need safety words, man. Banana hammock, banana hammock. Just like code words.
All right. So what is the final word about the psychology of kink, Michael Drane of the Unpopular Culture podcast and of Antioch professorship fame?
Let's try to destigmatize this last vestige in the DSM that still has a lot of holdover, and this, you go into a clinician and to get treated for bipolar disorder, you're not likely to be judged on that by the clinician. They're trained to deal with that. But if you come in with a kink and some issues around there, I have met clinicians that weren't comfortable working with people like that. So even within our own field, there's stigma around this. Sexuality is normal, generally speaking. If you are not hurting yourself and you are not hurting somebody else, you do you. You have fun and you explore however you can. It can be healthy. It can be adaptive, and go for it. Yeah, that's my takeaway.
I like it. Go for it. Well, that does it for that episode of Psychology in Seattle and potentially Unpopular Culture podcast. Thanks for joining us out there. Please take care of yourself because
you deserve it.
You said that sort of kinkily.
Very sultry.